First thing I'd like to talk about getting started is how to prepare to go to the ENT visit. So coming up to this, obviously to go to an ENT or to be referred to an ENT, you're obviously having a lot of symptoms. They may be throat clearing. I had throat clearing for years, and I always blamed it on postnasal drip, which it was partially postnasal drip, but it was due to the acid, the silent reflux causing the postnasal drip. I do have a deviated septum, so I blamed it on that all these years. And then I noticed that it got progressively worse right before I was diagnosed with LPR, to the point where I was constantly clearing my throat as soon as I laid down before bed. Even though I had my pillows elevated, it still wasn't enough. There was still drainage that constantly kept running down my throat. I was taking antihistamines, hoping that it would dry it up. And sometimes it would help, but really it just didn't do much at all. And it was just a waste of my time. And I was putting medicines into my body that really I did not need. So that was one of the red flags of getting it, was that constant throat clearing. And the more you clear, the worse it got. But then to stop yourself from clearing was almost impossible, because you felt like you were drowning in all of that postnasal drainage. So that might be a condition, that might be something that you want to document, to talk about the ENT about, make a mental note about it. So of course, the soreness, if you have any sore throats, lymph nodes, things of that nature, anything, heartburn, which with LPR, sometimes you really don't get any of that. It's more silent. So document all of these things down and symptoms as they happen, even if it seems silly. And maybe regimens. Do you use a sinus wash currently? Is there anything you're doing to try to remedy it? Are you taking antihistamines? Document everything down so that when you get there to that visit, when you start explaining your symptoms and what you are going through, you won't miss anything important. So that's number one. Make sure, write it down, make a note in your phone, whatever you need to do. Ask any important questions, document your symptoms, and then when you go to that visit, you'll be more prepared. And write down any questions you may have for the doctor while you are there, going along with your diagnosis. So that's number one. Number two, try to hydrate really well before you go to your appointment and get an endoscopy, because of the fact that some of the things that they use, which I'll talk about in a second, can dry, and the process itself can just be a little bit drying, especially if you have LPR. Your throat is usually already dry.